welcome you to Donnybrook Next Up. Ray Hartman and I are very honored to welcome Ken Haller. He is professor of pediatrics at St. Louis University School of Medicine, SSM Health, Cardinal Glennon Children's Hospital. He is also a pediatrician. So welcome. We're so happy to have you.
It's my pleasure to be here. Thank you, Wendy.
It has been a very grim week in the news.
Yeah.
A young person, we're not going to mention the name of the suspect, but created chaos once again in Nashville, Tennessee.
Yeah.
And there has been a great deal of interest in the gender identity of the shooter. And you can speak to that specifically, can't you? From a medical point of view.
From a medical point of view, gender identity, sexual orientation, gender has nothing to do with why people do these things. We're always looking for reasons for these things. Those aspects of a personality have nothing to do with it. There is something going on in that person that led them to do it. I don't know what it is. I don't know if we'll ever know what it is. But the thing is that is really irrelevant to this discussion. What is relevant is that this is a person who had access to guns, to a really, really powerful gun, who should never have had access to a gun like that. There should be controls in place to keep people who have these sorts of ideas, who have these sorts of plans, to get a hold of a weapon like that can cause such havoc and kill children.
Doc, of course, I've come to know you over the years for your generous time when I had the show on KTRS, and we should mention you're one of the leading cabaret singers in St. Louis as well. But to keep this on a serious note, mental health services are scarce at best in the state of Missouri, as an example, but they are especially scarce for kids. And talk about the importance of our state and our whole culture doing a better job of having there to be access that is affordable, that can be paid by insurance for kids, which you've devoted your life to.
This is one of those things that has been, that really gets down to healthcare financing. And I know that this is something that we've talked about in many venues. And the healthcare financing in this country is just a nightmare. It gives its biggest rewards to people who cut things and sew things and put things in people, and yet the cognitive stuff, the just sitting with a person and helping them to find who they are, helping them to find mental health is not paid for. I know for myself, as a primary care pediatrician, I don't do procedures, so when it comes to how much money people make, I'm down here. Now that's still really good. But the thing is that when we get to mental health professionals, they do not do any better, and sometimes they do worse. The thing is that mental health care is often not reimbursed by reinsurance. So health care insurance often does not pay for it. So people have to pay out of pocket, or there have to be special programs set up that you have to know about. And I know that one of the things that is in the primary care practice I'm in at Cardinal Glennon called Donny Pediatrics, one of the things we spend so much of our time on is trying to find mental health resources for our kids. And now our kids, especially after the past couple of years, post-pandemic, are in worse shape than they have ever been from a mental health standpoint. And getting them the care they need is just really, really, really daunting.
Do we need new laws? I mean,
who's making those decisions?
What are we going to, I mean, is there constructively something that can be done that affects parents and and families now, and their children, obviously? I mean, what should we be focusing on as the next step?
And is this coming from within healthcare, or is this a legislative?
This is really a legislative thing. I mean, the thing is that the way the healthcare system is set up, if you were going to medical school, and this is another thing. When I went to medical school back in the 70s, wow, back in the 70s, a lot of my medical school tuition was covered by what was called capitation. The federal government paid every medical school a certain amount of money to keep the tuition at a reasonable level. And then I got a National Health Service Corps scholarship, so I ended up working in a small town in South Carolina for a couple of years. And basically, I got my medical care or my medical education pretty much for free. So when I went into practice, I didn't have to worry, am I going to have to make $300,000 a year to pay off these loans? The students at SLU Medical School, at Wash U, at Mizzou, at every medical school, they're going to come out with upwards of $250,000 in debt. they're going to have a mortgage without a house. And they have to find a way to pay off that debt. And it doesn't have the kind of low interest rates that, even the few loans I had did back then. So the thing is that medical students have to make part of their calculation what is going to pay the most money. And when it comes to, again, cognitive things like internal medicine, pediatrics, psychiatry, those are among the lowest paid specialties. And so people self-select away from those things. And so there are fewer people in the pipeline to even fill those posts. And that's true even for other mental health professions, psychologists, licensed clinical social workers. The amount of money you make is just not that great, and most people in those professions will see people on a sliding scale, but they end up eating a lot of that, So we need to come up with a way to pay for these things, because mental health is health. And just like anything else, just like a strep throat, just like chemotherapy for cancer, just like getting your appendix out, mental health is health, and we as a society should be paying for it.
And you are a leader in the LGBT community. You've devoted especially certainly to that, I would think. Yeah. And what, in terms of the kids you see, the people and the families, what has been the impact of the effort to demonize trans people, which is undeniable?
This has been one of the most insidious, frankly, horrible things I've seen legislation and legislators try to do to a population of people in the nearly 50 years since I entered medical school. I have never, ever seen legislators say to a group of people, you cannot get medical care that will make you whole, that will contribute to your mental and psychological and spiritual health. I have never seen that happen. We have, I have a lot of friends who are trans, and they are scared to death. And these are even adults, people who are in their process of transitioning. They are scared that might not get paid for going forward. And when it comes to kids who come into our practice, people are thinking they may have to move out of state. Families may have to uproot themselves to move elsewhere so that they can get care that generally is not even covered by insurance, but they can't even get the care, even if they pay out of pocket. And for government to be doing something like this, for public policy to say that our government says you are not a worthwhile person and who you see yourself as is not valid as a human being, is one of the most destructive things we can do to a child.
Could you shed some light, because I think there has been a great deal of confusion over the Washington University whistleblower, because this was not somebody who was an outlier, who was anti-trans. This was somebody who was, for all practical purposes, or from everything you glean, a very thoughtful person. And I think that has confused the issue for a lot of people. Do you, Dr. Haller?
Yeah, I don't know this person.
Right.
I don't know who this person is. I do know the people at WashU, at the Gender Center, and they are the most ethical and meticulous and thoughtful and smart and compassionate people I know. And I know that they are meticulous about following the policies of the American Academy of Pediatrics, the Pediatric Endocrine Society, the World Professional Association of Transgender Health. There are very, very specific guidelines that families and children have to meet before they go from one level of care to the next level of care to the next level of care. And these are incredibly, incredibly stringent. So I don't know what this person saw, but I can tell you that no one I know at this center, I can't imagine anyone at this center doing the things that this person said. And from what I've heard from them, they don't know where this is coming from either. But like I said, there are very, very, very specific guidelines around this, around how when a child presents and says, that my gender is this rather than this, it's not like, okay, here's your prescription and we're doing surgery next week.
Right.
That simply does not happen. There has to be a stringent and lengthy psychological evaluation. And it's not until, early adolescence that there's even a thought of giving puberty blockers to prevent further development. In fact, on the what's called the sexual maturity rating, or SMR scale, there are five stages, And all of these organizations, you have to have reached stage 2 of that before you can even think about giving puberty blockers. And in terms of then going to hormones that would move the body in the direction of the target gender, no one would think about doing that before age 16. And I know that those are the standards they have at WashU. So I don't know where this person is coming from. I really don't.
What are the risks if a child is told it's not going to happen for you here in Missouri? What are the risks to not only the child's family, but the greater society?
What if someone told you that you have cancer and you can't get chemotherapy? We will not take out that tumor. We will not give you the treatment you need. As far as we're concerned, what's going on with you is something that's not valid. And if you die of it, you die of it. That is basically what a transgender child hears when they're told that they can't get the treatment that they need. And for a child who is going through these things and starting to see their body change and saying, this is not who I am, to be told that there's not something in the future that might allow me to first keep this from going further and then eventually help me to go in the direction I feel I truly am, is devastating. And there have been some studies of kids who are transgender, and about 85% of kids who are transgender are having major anxiety right now because of the things they're hearing happening in state legislatures. And, they're really afraid people are coming for me. And so what this does, it can lead to depression. It can lead to self-harm. It can lead to suicide. And there are kids who have committed suicide because they have been told you cannot get gender-affirming care.
Well, and we don't even know. I'm sorry, we can't even estimate how many previous generations have been impacted by this kind of thing.
Right.
Talk about the parents of transgender kids. The national political talking points, which is what this is about. This isn't a Missouri issue. It's a national, very profitably political issue in the culture war. Always creates this scenario where it's just some 10, 12-year-old kid walking in, asking for, some dramatic medical procedure, and it's as if the parents don't exist. In your experience, what are parents feeling? Do they tend to? I'm sure they're all over the place, but talk about the parents' role in this.
Yeah, again, Ray, I think you're talking about a scenario that we hear, in a lot of forums, where a 10-year-old comes in and says, "I'm really a girl." They say, "Okay, we're going to dress you as a girl, and we're going to get the hormones, and you're going to get surgery, and you're going to get all this stuff, and it's all like that." And that is not what happens. I know a lot of parents of transgender children, and this is a major, major, major journey. Anyone who is a parent knows that when you have a child, one of the first things you ask, besides, is my child healthy, is what's my child's gender? And of course now most people know that before the child is born. So that is a really, really concrete thing that people see as their image of who their child is. And when their child comes to them at some point and says, I don't think this is right, I don't think this is me. This is an incredibly, incredibly difficult and wrenching thing for just about every parent I've talked to. And it takes them a while to think about it and really look within themselves and have conversations with their kids and figure out how they're going to tell the rest of the family and, what does this mean for all of this and going forward. But when they go on this journey, when they find support for it, that's when they can finally start saying, okay, let's sit down and talk about where we go. We take this one step at a time. There is an organization, a national organization that has a very strong local chapter called Transparent. And if you Google it, I think it's transparent.org. It's an amazing organization for people who are going through this. But I have talked to parents who are members of that organization and others who aren't. And this is just something that is, as you can imagine, a life-defining thing for the entire family. For every family, there's a before and an after, and there's an in-between that takes a really long time. So this is not something that people do thoughtlessly or blithely or frivolously. This is an extremely serious thing. It's also an intensely private thing. And for government to come in and say, you cannot do this, and I'm going to interfere not just with your family, but your relationship with your doctors and with the people who who have spent their lives learning how to take care of you is, I find, an atrocity.
I'm glad you made that point about privacy, because we have all seen in the world of, I mean, the chaotic, upside down sometimes world of social media, you see parents who seem to be exploiting their children, and at a very vulnerable time. You know, this is our journey. What would is that part of the mental health screening process? Because a child, this is a very private journey, as you said.
Right. Again, as you said, every family deals with this differently. Part of the mental health issues that go into an evaluation of a child in a family, where a child is, saying that I am transgender, is to make sure that there are not other mental health issues that might be unresolved or unmet that could be having an impact on this. That could be either, that this might be, not necessarily being transgender, but something else, that this is the only way they feel they can express it, or that might cause them to suppress their own feelings about who they are. So this process is really long. I would say, for the most part, it is. I think that one of the healthiest things people can do is to be as honest with themselves and their community and their family as they can be, but also to realize that children, especially the younger they are at a very vulnerable age, and we don't want to put them in a place where they might be going out in the world and, because of social media, having to deal with things that frankly no one is prepared for.
The trans issue is, of course, is a part of a culture war.
Right,
it's a national culture war. We all know that. And I always say, I don't accuse the legislators in Missouri of original thought. And the most obvious one, I wrote about this in one of my final columns at the RFT, was, I won't even mention her name, the state legislature openly took the Don't Say Gay bill in Florida and basically cut and pasted it. And it just, to the point where she said, well, she was actually critiquing it and pointing out, as she introduced the bill and was at a committee to talk about it, she said, I really don't like this enforcement provision. It was the bill, her bill, but she was admitting that she didn't write it. And it was like, she was kind of qualifying it as she introduced it, which I thought was historic. But as a gay man, as a member of the LGBTQ community, what do you think the impact of us having a discussion about don't say gay in school, and also as it pertains to mental health of the community?
Yeah. I am, of course, very old. I'm almost...
Not as old as me.
Yeah, but just close.
Yeah.
But I'm almost 70, so of course no one said gay when I was growing up. But people didn't talk about sex either. I mean, people just didn't talk about this stuff. So if there was one good thing about that, it's that I could sort of think about it myself without having to worry about, this. I can go into a latency period for a long period of time. When this sort of thing happens, and as a member of an LGBTQ community, to feel that I have a target on my back from the government, I mean, that's a huge thing. When I think there may be public policy saying that I and people like me are in some way outlawed, is incredibly, incredibly stressful. And because the thing is, whether we, I mean, sometimes we say, well, government really doesn't matter, but it does. When the government says, when there's a law that says something, I may not agree with it, but I also know that there are consequences if I don't follow it. And if there's a law that says something about what I can do as a physician, what I can do as a gay man, who I can take care of, who I cannot take care of, whatever I feel is right, I also realize that there are consequences if I don't pay attention to that law. And that is never a good place to be, that my conscience has to be in conflict with what the law says.
And you know what's kind of interesting? Earlier on the Donnybrook portion of tonight's program, we said we are the government, and words matter. And if you are a young LGBTQ member of the community,
right,
and you're talking about the government is you would be suspicious of all of the people living in your neighborhood or who surround you, I think.
Yeah, yeah, yeah. And that's the sort of thing, this sort of demonizing. I mean, I kind of feel like there's a McCarthyist kind of feeling about this, that, I mean, are you now or have you ever been a member of an LGBTQ community?
Right.
I mean, it is stigmatizing, and it has been it's been really off. Now, I will also say, having said that, because I am out and because I've been out for a really long time, that is something that I think has immunized me in a lot of ways, because people can't use this secret against me because it's all over social media and it's all over public television right now. So the thing is, I would also say to people out there who are in the LGBTQ community, if you possibly can, please come out. It is, Harvey Milk said, coming out is the most political thing you can do. And telling the world, this is who I am, and you have to deal with it, is huge. Because then we're not just talking about those people, you're talking about me. And if you're going to say this to my face, you have to look me in the eye, and I am going to look back at you. And that is incredibly powerful.
We have noticed, certainly in talk radio, a sea change when it comes to acceptance, even on the part of many people to the right of center, because they know as time passes, they know people, they love people who come out and identify themselves. And I think we've seen the same thing in this state with marijuana, because somebody that I love had chemotherapy and it brought them incredible. So things are changing. Are you optimistic? Is there, even in spite of?
I think ultimately I am, and and I try not to get too overtly political. What I want is good policy, and I'm willing to support any politician that espouses good policy. It's just unfortunate there's only one party that I feel espouses good policy. But my point is that when it comes to these sorts of things, just when policy is out there, when people know people, it makes a difference. And so that's one of the reasons that I have chosen to be out. And I will say that I really haven't, I don't know that I've ever had a patient say, I'm not going to him because I'm gay. Now, they might just never have come back, but I've never heard anyone say that, because they also know me as a doctor. And because they know, the whole of who I am as a physician, as a healer, they might go, wow, maybe I need to rethink that. And I think that is a very powerful thing. So that's what I would say to your viewers. If it is possible and you're not quite out, there are a lot of us out here, and ultimately it is a really great thing to do.
You're one of the most empathetic people I know, and you are. And I back kind of a corollary to the question I was asking you about the parents of trans kids, is you as a pediatrician are connected both to the patients and the parents.
Yeah.
Talk about the parents of gay LGBTQ kids, regardless of what their orientation is. What's their journey like? And particularly ones that, I don't know if you get into the politics much of your patients, or their parents, but what is it like for them? Because I would think some of the parents of your patients are, whether they might be Republicans, they're certainly conservatives in a lot of ways. How does this land on them?
Yeah. I think that for the parents of children who are LGBTQ, again, they're going through a major change in who they, and how they envision their child, who they envision their child to be. And it's pretty big, because again, I think there's this default that they will get married to a person of the opposite gender, and they'll have kids, and I'll be a grandparent, and we'll have fun and picket fences and all that kind of stuff. So the thing is that when we are talking about this, I will, if people are having trouble with it, I'll say, what's really changed about your child? what do you love about your child? Well, I love this, I love that. That hasn't changed. That's still there. This is still your child, and they still need you. And that's what really makes a difference, is just saying, there you have this amazing gift, you have this child, have this human being, and this child is entrusted to you for as long as you're willing to do that. And you can either make this child a really wonderful, empathetic person by showing that to them, or you can show them what it's like to feel shunned and rejected, and that will turn them into someone like that. And what do you want for your child?
And so in the minute or so that we have left, to the viewers, if you see somebody trying to connect the gender identity of the shooter in Nashville, Tennessee, just be rational. Just be rational and ask yourself, of all of the other mass shootings and these tragedies, these horrific tragedies, when has that ever come up? Does that make a difference? It does not make a difference at all.
Right. These kids and these adults are dead. And they were killed by someone who had terrible, terrible, terrible issues and got a hold of a very powerful weapon. And as a society, we did not address the terrible issues and the weapon, and that's what we need to do.
Dr. Ken Haller, we thank you so much for being here and for being so generous with your time and your heart. He is professor of pediatrics at St. Louis University School of Medicine and a pediatrician with SSM Health Cardinal Glennon Children's Hospital. For all of us at 9 PBS, have a wonderful evening. Have a terrific weekend. We'll see you next Thursday. Good night.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9 PBS.